Alright everyone, let's talk about a gastro case, indigestion or acid reflux. As I told you before, every mind map will look at three angles. First angle, a possible story, how a patient with indigestion can present to your clinic. And second angle is looking at the guidelines, what is written in nice guidelines, so you are confident when you discuss your management. And the third angle is actually giving you one piece of mind map that has all of that. Let's start with a possible story. That can be a gentleman coming to you in the GB clinic because he has some heartburn or acidity in the stomach. That may be happening for years, and that may be triggered by some habits such as spicy food or maybe oily food or maybe smoking or coffee. That is the typical picture of heartburn or indigestion. Otherwise, when you talk about maftosa, he may be a fit and healthy gentleman and he may have tried over-the-counter indigestion medicines such as Gaviscon or Rene, which can be bought over the counter. When you examine, everything may be totally okay, and then when you talk about ice or concern or expectation or idea, he may be worried if that is a cancer, so make sure to address that concern. He may ask you for a scan, so make sure to address that expectation. He may ask you what is the reason, and we can answer that quite easily with the guidelines. Second angle, we look at what is written in NICE CKS. What is the management for anyone with indigestion? The first part of management as per NICE is what the patient can do. The conservative part, initial management of person with dyspepsia, will include offering advice on lifestyle modification. For example, cutting down smoking, alcohol, spicy food, coffee, etc. And then managing any associated stress or anxiety, because that is a risk factor as well. Reducing or stopping any medicine which can trigger dyspepsia, such as NSAIDs, for example. That is the first part of management. Second part of management is the doctor part, what the doctor can offer to ease indigestion. You have two options as per NICE CKS. You can either offer a full dose of omeprazole or proton pump inhibitor. You can offer a full dose of that for 1 month, 4 weeks, or look carefully for or. So you can offer either of these options. You can offer testing for H. pylori test if the status of the patient is unknown, and that is a urea breath test. But to offer a urea breath test, the patient should not be taking any omeprazole or proton pump inhibitor in the last 2 weeks, or he shouldn't be taking antibiotics in the last 4 weeks. So why or here? Because you cannot give both together, because if he's taking a proton pump inhibitor, we cannot test him for the bacteria because that would be inaccurate. He should not be taking any medicine such as BPI for 2 weeks at least. Yeah. So when you offer management, you will offer one of these options, either giving a medicine to ease the symptoms or either not giving anything and testing for the bacteria. And then the third part of management, if he's asking you for a referral, it is not needed. So referral is only indicated as per NICE. Referral to gastro or for endoscopy should be considered only if there are refractory symptoms despite optimum management in primary care. Is that our patient? No, that is not our patient, because the story we have seen together, he is coming for the first time to me today, so it's not refractory yet. I haven't tried anything yet. What is the second indication to refer if he is trying with a second line H. pylori and it has been unsuccessful? Is that my patient? No, he's coming for the first time, so I haven't tried anything yet. What is the third indication? If it is there is a limited antibiotic option for H. pylori, for example, if the patient is allergic to maybe 3 different categories of antibiotics. Is that my patient? No, not my patient yet. So no need to refer for endoscopy, no need to refer for gastro. For a first presentation of dyspepsia, you need to try to treat first, and then if it is refractory or resistant to treatment, then you can refer. I hope the knowledge is clear from NICE CKS. Now if we look at the mind map, it will be quite clear. Let's start presenting complaint. Someone coming with heartburn or stomach upset. I will ask an open question. Can you please tell me more about that? The same start as every time. After I listen to the golden minute, I will still complete what is missing from Socrates. So can you tell me what exactly, how does it feel like? Where exactly do you feel that pain? How long does it last? What makes it better? What makes it worse? So I need to complete, of course, Socrates. Second step, as we do every time, trigger. Was that triggered by anything at all? He will give you valuable information such as, yes doctor, whenever I eat spicy food, whenever I have exams, whenever I am stressed, whenever I drink too much alcohol. So he will give you some triggers to make it clear-cut diagnosis. And then we finish presenting complaint by asking about other. I always tell you there are 2 others. One other for the patient patient to help you, you ask the patient an open question about other, Mr. Smith, with that pain, do you have any other symptoms at all? He may tell you, I feel some sickness or blah blah blah. The second other for you as a doctor to ask about other symptoms of the same system. Why? Because the most close differential to your problem will be other problems of the same system. So ask about other GIT symptoms. With that, you can go from up down, by the way. With that, Mr. Smith, do you have any nausea at all, any vomiting, any change in your bowel habits, constipation or diarrhea or bleeding? So ask about that, and that will be quite clear-cut diagnosis. Second step, asking closed-ended questions for red flag and differential. What can be the red flag? What can be the big elephant? Cancer? Yes, so ask about cancer. With that, Mr. Smith, have you experienced any unexpected weight loss? How about your appetite? Have you noticed any lumps or bumps anywhere? So ask about 1 or 2 questions about cancer. And then what is the red flag for you? What is the red flag for you that can make it urgent? If someone has indigestion, if it affects his swallowing, that can be quite urgent because that can cause dehydration. So how about swallowing? Any difficulty with swallowing at all, Mr. Smith? Are you able to drink and keep fluids okay? So difficulty swallowing will be a differential and red flag, because that can be cancer, for example, and it can be esophagitis, which will require different management. It will be negative here as well. And then the last one in my differentials will be maybe the other system above, which can confuse some patients with the indigestion. Someone comes with a stomach pain, it can be chest pain, but he is mistaken or he's mixing them up. So ask about 1 or 2 chest symptoms, Mr. Smith. With that will be including any differential that may come in your mind. Mr. Smith, with that, do you have any problem with breathing at all, any coughing or any chest pain? That will be quite enough. Do not go crazy more than that. Think as a businessman. The third step in every mind map is general well-being of the patient or relevant maftose. Ask, have you been diagnosed with any medical problems at all? Are you taking any medicines on a regular basis or over-the-counter medicines? Why? Because if he's taking aspirin or ibuprofen from over-the-counter, that's a contributing factor. That's one part of my management to address, okay? Or maybe what did you try to help with that? He may have tried Rene or Gaviscon from over the counter. Family history, anyone in the family is experiencing similar symptoms, or any family history of bowel related or stomach related problems at all. And then how about your lifestyle, Mr. Smith? Do you smoke at all? Do you drink alcohol? How about your diet? Do you follow any certain diet at all? Why? Because smoking, alcohol, bad diet is a risk factor. So of course ask about them, commit to the answer to know the risk factor. And then we finish every presenting complaint with psychosocial and ICE. Ask psychosocial for 2 reasons. One of them, how this problem has affected his life. He has been having it for years. That's very essential. The second thing, psychosocial or stress in the life is a risk factor for you as well. So every step in the mind map is for a reason, for a relevancy. How to ask psychosocial? Again, as I told you before, or as you have seen in the IBS session I have done before, ask him how that has been affecting you or has been stopping you from doing anything you used to do. Or how about stress in your life, Mr. Smith? Sometimes stress can trigger such symptoms at all. What do you think about stress in your life? He may give you some meat in that step. I, as the patient, what do you think may be causing that for you? Anything specific is worrying you about that pain? Yes, doctor, I'm worried if it is cancer. Expectation, have you given any thoughts? How can I help you today? Or maybe, were you hoping for anything specific I can offer you today? Yes, doctor, if you can offer me a scan or a camera test, because he's worried about cancer, for example. That is important information for you to know, because when you address that information in the management, you get the clear-cut 12. And then you finish data gathering by offering examination, relevant examination, such as, Mr. Smith, I would like to examine you. That will include me checking your heart rate, your temperature. I will be feeling your tummy and examining your chest as well. And we'll be looking at your mouth and taking your weight. These all are the relevant examination. Do not say head to toe or general physical. That is rubbish. That is for weak people. You as a doctor offer what is relevant to the case only. Then you have a clear-cut diagnosis of indigestion. Let's see how we discuss that as per the guidelines and as per the mind map you can see in front of you. Mr. Smith, having listened to you, having examined you, I think what you're experiencing is acid reflux or indigestion. Have you heard of that before? No, doctor. Then explain it in a simple language. That is burning feeling in the chest due to the acid traveling up from the stomach to the throat. Mr. Smith, I'm aware you have been worried about cancer may be causing that for you. I'm happy to reassure you it's unlikely to be, because cancer would cause different symptoms such as difficulty with swallowing or bleeding, but your symptoms are more typical of acid reflux. For us to help you with that, Mr. Smith, there are a couple of things we can offer you and a couple of things you can try to ease your symptoms. And then you talk about lifestyle changes for him to try. Things you can try to do yourself, Mr. Smith. We know that eating spicy food or drinking alcohol or smoking cigarettes, you will choose whatever whatever was wrong in data gathering and correct here. So we know that these things can trigger the acidity in your stomach or can worsen your symptoms. So we strongly suggest if you cut down on these habits. Things we can offer you, Mr. Smith. We have two options to offer you. We can offer you a medicine to ease your symptoms called omeprazole, which you can take every day in the morning before breakfast for the coming 1 month. That's option number one. We have another option that we can test you for a bacteria which can cause similar symptoms, but for the accuracy of that test we cannot be giving you any medicine. What do you think, Mr. Smith? Which option would you like to try first, taking the medicine or trying the test first? Doctor would like to take the medicine, for example. Then you can go for the medicine, omeprazole, for 4 weeks or so. Of course, you can sign both. Mr. Smith, if you do not get better with the medicine, we may need to try to do the test in the next follow-up. And if you do not get better with what we try in the clinic, we may need to refer you later to see the gastro specialist or the gut specialist. Yeah. Doctor, can I have a camera test? It's unlikely to be of help that time, Mr. Smith, because it looks quite typical to acid reflux, which can get better with the medicine we're going to give you today. And then safety net the patient. If it gets worse or you have any additional symptoms such as problem with swallowing or unexpected weight loss, please do come back for a review. You can safety net him as well that he shouldn't be trying things over the counter such as ibuprofen or aspirin, because they can trigger his symptoms. Offer a leaflet to the patient. I'll print a leaflet for you about indigestion or acid reflux. You can read more about it, and if you have any questions you can call us back for a follow-up. On the meantime, we'll hope to see you again in 4 weeks time so we can review your response to the medicine. As you can see, everything is covered in one single mind map. I would stop here, and as you know, if you like to join the package, you can text me on that number, and we have a package that includes everything in a similar mind map such as that. I wish for you clear cut 12 out of 12. Thank you.